Now we are coming to the stomach 9. Now the important points are coming here to treat for the thyroid, parathyroid and thymus. Now 3 points I'll tell you. Now this is the thyroid gland. This is the thyroid gland. Hope you understand. This is the laryngeal prominence. Laryngeal prominence are the thyroid cartilage or the Adam's apple. Right. From here, so 1.5 tune lateral. 1.5 tune lateral. This region to be known as a Ren ing, that is the stomach 9 point of them. So stomach 9 point. Stomach 9 point, I just applied stomach 9 point, right? CM muscles, sternocleidomastoid muscles. Now, so this point is run in to treat for the parathyroid gland related disorders. Do you know there is the thyroid gland, parathyroid gland? There are the two glands are existing on the thyroid, but there are the certain hormones will going to release. So here, what are the hormones will going to release? Let me see. T3, T4, TSH and calcitonin. You remember T3, triiodothyronine, thyroxine and also thyroid stimulating hormone and calcitol. These are the four important hormones are regulated by the thyroid and parathyroid glands. So in that glands you wanted to treat, then definitely so we can use the another point is stomach 9 and then stomach 10 and then stomach 11. So stomach 11, first we try to find out the stomach 11. 1.5 tune from the suprasternal fossa, and then this is the clavicle, the superior clavicle fossa vertically below the stomach 9 point to be known as a stomach 11. Midway between the stomach 9 and then stomach 11, the point to be known as a stomach 10. That is Ren Ing Shui Tu Chi Shi. So there are the 3 points are located in the one direction. So now these are the 3 points are treatable for the what conditions? Parathyroid. Ren ing, the stomach 9 point is treatable for the parathyroid, stomach 10 is treatable for the thyroid, and then stomach 11 is treatable for the thymus gland. Right, thymus gland is very important. You know there is the 2 points, thyroid points treatable for the hyperthyroid or hypothyroid. So anything there is two conditions, you can use it this point as a local points, and also there is a goiter or the thyrotoxicosis. You can use the superficial needling, not to the very deep needling. However, you can do it as a fire needling technique to treat for the goiter, but if it is not there, then don't puncture and damage to the inside of the thyroid gland directly. But however, you can apply to the 0.3 tune, 0.4 tune, a needle can be inserted on that particular region. Now the third point to be known as a thymus point. So normally below the 14 years of the age, if the children having the problem, for example, the growth, the development, and then malnutrition, or there is the CP child, or maybe Down syndrome, or the not speaking children, very oftenly get the cold and congestion, cough and asthma, lungs related disorders, and the growth is not really good, and their speaking difficulty is there, where the lymphatic system and also there is immune system having the deficiency. On that situation, you can use these 3 points together to treat for the immunity will going to develop to the children. But at the age of 14 years, you can use it this point. After the 14th year, the thymus gland slowly will going to dissolve, and till 14 years, the T cells will going to release and produces by the thymus gland, which is most essential to rectify the immune system will increase to bring the any kind of the foreign particles or the foreign substances will enter into the body to causes the infection or the inflammation that can be subsided by getting the secretion of the T cells through the thymus gland. So therefore this is really important to treat for the all the throat related disorders. You can use it bilaterally or you can use it as a unilaterally. That is good, but better I suggest you are treating for the because parathyroid, how many glands are there? Four glands are there. Right side is the two glands, the other side is the two glands. So therefore you can use bilaterally. Parathyroid is very most important to regulate the calcium metabolism. When the calcium is deficiency, vitamin D3 is deficiency, but it's taking care for through the parathyroid gland. So you wanted to use calcitonin, it's get releases. You can use bilaterally, that always is good. That's the reason the endocrinologist normally they prescribe the medicine along with the FSH medicines related to the L-troxin or thyroxine medicine. Along with that they prescribe the calcium tablet as well. Why? Because the parathyroid gland is not totally functioning, so that's the reason they add up the calcium tablet as well. So I recommend you better you can use this the protocol to treat for the 2 plus 2 4 points. You just activate for the thyroid and parathyroid gland together to treat for the thyroid related disorders.